Dentistry Young Alumni event, which is part of our first ever Great Alumni Event Home Edition. I'm Selena Estes, the Director of Advancement. We're just seeing some people getting on the call, so we don't want to rush too far, but I am about to introduce our panel, and then we're hoping for a fun and casual, lively discussion. Please feel free to send some questions in through the chat or stories you want to share as well with the group. We welcome hearing from all of you. So I have the pleasure of introducing our amazing speakers and panelists with us this evening. We have Dagmar Justa, and she is a proud graduate of the class of '81, celebrating her 40th reunion year, and she is our moderator extraordinaire tonight. Dagmar had a practice in Markham, which she sold a few years ago, and she has, after selling her practice, worked in remote areas in Sioux Lookout. Currently, Dagmar is an instructor in dentistry in U of T's Emergency and Oral Diagnosis Department. Just some fun facts, she has 2 professional daughters, and 10 years ago, she climbed Mount Kilimanjaro as a fundraiser. So welcome, Dagmar.
Thank you.
Just before I turn things over to you, Dagmar, I'll introduce our other 3 panelists. So Michael Park, he is class of OT6, celebrating his 15th reunion year. Dr. Park is a clinical instructor as well at the faculty. And additionally, he's practicing on staff at Mount Sinai in Toronto and at the Grand River Hospital in Kitchener. He's a fellow of the Royal College of Dentists of Canada in pediatric dentistry and a board certified pediatric dentist, and the American Board of Pediatric Dentistry. So welcome, Michael.
Thank you.
Nicole Maciel is class of 1T1, celebrating her 10th reunion year. Dr. Maciel graduated with honors from the U of T Faculty of Dentistry in 2011 and joined the team at Winston Churchill Dental shortly afterwards. She was also a recipient of the Gordon Cressy Student Leadership Award in 2011. Welcome.
Hi.
And then we have Monica, and I will tell everybody right now, Monica's internet's a bit dodgy, so if we lose Monica and she comes back, nobody panic, she's still with us. So Monica is class of 1T6, and she's celebrating her 5th reunion year. Dr. Pulec graduated with honors from the faculty. While in school, she received various awards, including recognitions in oral surgery and pharmacology. During this time, she also completed an externship in periodontics at Columbia University in New York City. Welcome, Monica. So just a little bit of housekeeping. After the event, you'll receive a post-event survey asking for your feedback. Your honest feedback always allows us in the Office of Advancement at the faculty to provide you with interesting and engaging program. Thank you so much for taking the time to fill out the survey. So throughout the event, as I mentioned, you can please send in questions using the Q&A function. And at the end of the discussion, we'll have the opportunity to answer some of them from the audience. Please note that the chat function is open. We encourage you to share some of your own memories from dental school and connect with each other in the chat. We expect to be wrapped up in about 45 minutes to an hour, and we are going to record this event. Thank you all again so much for being here. Dagmar, I leave it to you.
Thank you, Selena. Okay, let's get started. Welcome, everyone. To start us off, I'll start with the first question. What were you thinking when you got your acceptance to dental school? Michael, want to get us started with this question?
I was actually surprised that I got into dental school because when I had applied, I just applied on a whim. It sounds kind of conceited, but I was more shocked and surprised that I got accepted. So it's just, in shock that I had gotten in because I didn't think I would for it. So
I think that's kind of similar with everyone. You work so hard, but you never think it's good enough. And then when you get that acceptance, you're like, me? No, me? Like, it's surreal, right?
Perfect.
Yeah, it was definitely, it was a huge relief. And I know I had my Western interview come up, I think like the week after. I'm like, I'm not going to that. Like, I got into U of T, that's where I want to be. So I was very happy and very relieved when I found out.
Yeah.
Awesome. That's great. Perfect. So any one of you, can you share your favorite dental school memories?
If you don't mind, I'll start off. One of my favorite memories was participating in Dentantics. You know, from
Yay.
first year, second year, third year, and participating in fourth year as well. Normally, it's not a fourth year, you know, heavy participation, but you know, having been kind of on stage for the first 3 years and then behind stage as well, being as part of the band, that was a really fun time to kind of like hang out and bond with other dental school classmates, not necessarily in your ear, or those in you know, those that were in grad school, you know.
And being able to make fun of your demos.
That's funny. I'm popping on only because Michael, your audio did something squirrely there.
Yes.
It disappeared on me for a second.
Oh, I'm sorry.
That's okay.
Yeah.
It's good. We heard you. Yeah.
Okay.
And I know, Dagmar, you were in Dentantics too, right?
Yes, I was. And back in dental school, I was part of the U of T gymnastics team. And then I got into dancing. So that was my favorite activity at U of T to dance in Dentantics. And also Dr. Lynn Tompkins too. She was my partner in crime.
Oh.
We have pictures to prove it.
So funny.
Oh boy. Okay, so moving right along. Who was your favorite teacher instructor and why? Michael?
Mike Park.
Oh, you go. Okay.
But am I going to go first, or are you saying that I'm your
Okay,
favorite
Michael
instructor?
No,
or
you're
Monica
demo.
from Nicole.
No, I'm just Mike was honestly, he was one of my demos in keto.
Oh, no way.
And I'm not just saying this, Mike. You actually made it a better experience for me. And to look around, like, this is what I do 90% of the time. I'm not a pediatric dentist, but I thoroughly enjoy working on kids and just being able to give you a call when I have a difficult patient or I need some advice. You really inspired me. So thank you.
Maybe I can inspire you to apply to the graduate pediatric dentistry program.
Still not going to do it. Nice try.
Oh, that's awesome.
All right.
Perfect.
Yeah.
What about you, Michael? Who was your favorite instructor?
My favorite instructor in dental school, well, this is actually in grad school because I did my pediatric dental training at U of T. My favorite instructor was a gentleman by the name of Dr. Michael Siegel. He was the head of pediatric dentistry for about 25 years or so. And he had also been the chief of dentistry at Mount Sinai. And so I had an interesting relationship with him in undergrad dental school because I actually first met him when I slept through his exam. And yeah, we hit it off right away. And so yeah, for some reason I still am very blunt and honest. And he, I guess, appreciated that honesty. So he took a risk and accepted me into his Sinai residency. And then also agreed to take me on as one of his grad pediatric dentistry residents. So he played a huge role in my training and understanding of pediatric dentistry. Amazing.
That's awesome. That's awesome.
Yeah.
Very nice. Beautiful. Okay, so another question. Tell us about a time when you did something fun outside of the classroom. What extracurricular things did you really love at dental school? Who wants to tackle that? Monica? You look like you do.
Well, I also did actually. I participated in Dentantics, and actually, I don't know what kind of gymnastics you did, but I trained in rhythmic gymnastics for many years. So I actually did that for I think it was first year when I was in first year I did it, and then I did it when we were third year.
Yeah.
I said, okay, I'll do it again. So Dentantics definitely was a lot of fun. I was part of ZIP, and the ZIP experience was a lot of fun as well. And yeah, I think maybe like fourth year in general was the best year. That was the best year, I think. Yeah.
That's amazing.
I don't know what you guys, what your experience is like.
What
ZIP,
about
honestly, just it got me through dental school. Like, I'm sure everyone knows how hard it is, especially third year. I don't know if that's still the same or not, but just having those people and having mentors and people that you can kind of talk to outside of school, and it was just like totally invaluable to me. I'm so thankful for it.
Yeah.
I have a question, actually. I know I said I'd go away, but I'm fully invested. I'm listening. I'm so sorry.
You're having fun.
I am having fun, and I'm interested. Nicole, when you say third year is the toughest,
I don't know if it still is, but
yeah, but I don't know that, right? Because I'm not a graduate. So was that also your experience, Monica and Michael? Like, is third year a real tough year for the program, and what makes it? Why is that so hard?
At least personally, I felt is that when I was in third year, you still have a very heavy course load. You have probably some of the hardest courses you'll ever take in dental school. And on top of that, you're really thrown in clinically. And it's the first time that you're doing dentistry on patients. So it's a lot. It's a lot clinically. It's a lot still didactically. And then the exams were just brutal at the end of the year.
I remember they had 9 exams in 3 weeks. Like, I remember that it was just insane. Was it still like that?
Yeah, it was like Monday, Wednesday, Friday.
Yeah.
Monday, Wednesday, Friday.
Yeah. I remember a lot of people, I think a couple people in my class actually quit after that. So it's kind of rough.
Oh, really?
But yeah. Light at the end of the tunnel, though.
I did not see the sun for the month of April. I think I developed rickets from my lack of vitamin D. Yeah, that exam schedule is not the kindest, and and that's 15 years ago now, right? Like we've asked to change it, and unfortunately there is no way around it. It's the gauntlet. You make it through third year, fourth year is
good.
Yeah, you're good.
I think that's good advice, actually. If you can get through third year, you are well prepared to get through fourth, and which can seem daunting, I suspect, right? As thinking you're taking on full patient caseloads, right? But anyway, the program I've heard is super rigorous. So anyway, I was interested to understand that. Thanks for sharing. Sorry, Dagmar.
That's okay. That was nice. That was a good question. So another question, how would you say the profession has changed since you graduated? Who wants to answer that?
Ooh, because I'm the oldest of the panel. I will go first.
Go.
When I was in dental school, we were told that your uniforms or your outfit attire, you were only allowed white shoes without any stripes or any colors of any sort. I was told that my piercings and my hair was inappropriate and that I would need to change these, change my attire or my piercings that I still have to this date. And that I would be expected to wear a shirt and tie, right? Which I think most individuals who are graduating now would probably not want to wear a shirt and tie or a blouse or nice clothes when you got all this splatter on your face, chest, arms, and stuff.
Exactly. Who else wants to comment on that? Nicole, do you want to say anything? Or?
No, I'll save it for another question.
Okay. Monica? No?
No, I've only been practicing for 5 years, so I haven't really noticed a huge difference over 5 years. Obviously, COVID changed the way that we all practice, but that would really be the only thing.
Right. So true. Okay, so on to the next question. If you could go back to university today, what would you do differently?
It's funny because my cousin is in third year dentistry at McGill, and I tell him all the time, make more mistakes in dental school. Like, I know that's probably the last thing you want to hear because everyone wants to be perfect, but make your mistakes when you have your demos right next to you. Because, like, perfect example, I was here Friday night, emergency came in, kid went over his handlebars, and I can't just knock on the door and be like, hey, can someone help me? I need advice.
Call this guy.
Make you, pardon? What'd you say?
Call me.
Call you? Yeah, no.
Michael.
Yeah, no, bad trauma. But yeah, make mistakes and ask the questions. How do I get out of this? Or what do I do in this situation? What would you do in this situation? What are my options? I felt like everyone was just so quick to do the best job and just to get out of clinic early. Like, pick your demos brains because they have the experience, and there's going to be times where you're going to really wish you had. That's probably the biggest regret I had.
Yeah, no, so true.
Yeah.
And how do you think dental school prepared you for your work today? Anybody wants to answer that?
I would say that dental school, specifically at U of T, provided you the scientific knowledge and the background to understand, you know, why things are happening, right?
Yes.
You know, I mean, the one, I guess, downside is that because U of T has all of these specialties, you don't get to necessarily complete all the difficult cases because they go up to the graduate programs. However, you know, you are taught the, I guess, the basic fundamentals, the foundation, the building blocks, so that you can understand it, so that when you get out into private practice, you can, you know, if a sales rep is trying to sell you something, you can understand, you know, would it work, yes or no, right? Or if you have a difficult tooth or a difficult case or a difficult situation, you know, you can go back to those principles that you were taught and kind of, you know, base it upon that and speak to, you know, your peers, right? For it.
Yeah. That's true. And what advice would you give to the students at the school now? Michael, do you want to?
So I think similar to what you know, Dr. Maciel said is make your mistakes now. I say, you know, when I teach, you know, pick my brain and use and abuse me for whatever information you need. I'm here to contribute to, you know, the next generation, and I have no qualms about answering any questions that you have about, you know, private practice or cases or clinical scenarios, because that's kind of, for me, that's the way I learn. It's through word of mouth and that. So that's one aspect of it. And the other aspect would be to enjoy your time while you're in dental school. Because when you get out into private practice, it's, you know, patients are paying hundreds, if not thousands of dollars for your services, right? So you got to be on your A game, right? So if you go in, you know, not knowing what you're doing or hungover or, you know, sorry, well, rabbit hole.
Rabbit hole. It's okay. Do you want to explain that? What did you mean by that?
No, don't explain that, Michael.
No.
I just mean that the patients,
No.
the patients will be paying a lot of money for your services, and you want to provide the best care that there is.
Okay. Awesome.
Yes.
Awesome.
So
Nicole?
to people listening, we had to censor Mike before this
A
started.
5-second delay? Yeah, I probably should be.
Yeah.
I'm sorry.
I guess one of the biggest things I can say to the new grads is, Mike touched on it, like U of T is very heavy didactic wise, but I did not feel ready at all when I came out into private practice. Like, and I'm sure you guys are kind of all in the same boat, or maybe not. So you're just way better than I was, but I didn't have a lot of hands-on experience, or at least I didn't feel like I had a lot of hands-on experience. And you go from having 1 or 2 patients a day to now like 20 patients a day, and
We're having some,
time and everything. Oh, can you hear me?
your sound, yeah, you just cut off a little bit.
Oh,
Um,
one of the biggest things is be very picky when you choose a practice that you're going to join. Really talk to your coworkers, talk to your primary, and make sure they are willing to mentor you and let you learn and be a little bit slower and ask questions and have the patience to answer. Because to me, that's where I learned the most. I've been in the same practice for 10 years now, and I'm not even thinking about leaving because it's just such a great environment for me personally. So sorry, Mike, I'm not going into pedo.
No.
Yeah. Keep trying, maybe in like another 10 years now. But that's my biggest thing is I learned way more from great coworkers than I did in dental school. Clinically, I should say, but that comes with
Clinically,
experience. Yeah, clinically.
yes. So true, so true.
Yeah.
And Monica, do you have anything to add to that or any thoughts?
So I would agree with Nicole. I mean, we do learn a lot in dental school, and I mean, you're only there for 4 years. They can't teach you everything. They teach you the basics. But once you get out into practice, you know, do what you feel comfortable doing, figure out what you like to do. And then my biggest recommendation, invest in good CE to learn more about what you actually enjoy doing. So for me,
We're having some technical
I
difficulties.
spent the money. Oh, sorry, can you not hear me?
Now we can hear you. Yeah,
Oh.
you just cut out a little bit. Now it's
Where
okay.
did you lose me at? Where
Like-
did you lose me at?
Good CE courses.
Yeah, CE courses. That's right.
Oh, yeah. Just figure.
Now we lost you. It's okay. Okay.
Stop my video.
Yeah.
Can you hear me better if I stop my video?
Now we can hear you.
Now it's better? Okay.
Yes.
So yeah, basically just figure out what you like to do, invest the money in good CE courses, and then you can really see your practice grow. And you'll enjoy practicing more because you're doing the things you like to do and you keep on challenging yourself.
Great. Okay. So I'll go on to the next question. What advice would you give to the newest grads? Nicole, you want to start off?
Sorry. I guess that was the biggest thing is just be very picky on who you choose to practice with. And it's okay to not know what you're doing and to be a little bit scared. But you guys all brought up good points. Just make sure you guys have colleagues that you can talk to, take good CE in what you're interested in, because you can't be great at everything. Like you will never be great at everything. You might know how to do little bits of everything, but pick your battles, pick the things that you want to do and refer out the stuff that you can't or you don't feel comfortable. Just don't bite off more than you can chew, because I feel like that's when people start to get into trouble a little bit. And so just start off slow and take your time.
Perfect. Yes. Michael, anything to add to that?
I would actually say that for the new grads out there, consider applying or consider going to a GPR or a residency or an HDR residency or an AEGD, some sort of advanced education for a year or so. Just so that, again, you can mine the attendings' minds for information and strategies on how to do things, right? Obviously, I'm biased because I've been to U of T through and through, and I did my residency at Sinai. And so, I just look at the staff at Sinai now, and I see, Howard Tenenbaum, I see an Andrew Moncars, I see a Dr. Burgess, I see a, Bruce Freeman, right? A whole plethora of oral surgeons, right? And Dr. Cascone. And you just, while I was doing my residency, I would just milk them for information, right? And observe and watch and see. And so, even though as a pediatric dentist, I don't do, 99% of those procedures or that I saw during my Sinai residency, I still have an appreciation and understanding for that. So then, yeah, I would say do an HDR, GPR, AGD, especially now during the COVID world where a lot of the fourth year students did not get that clinical experience.
Exactly.
Yeah.
So true.
It's only a year, right?
Exactly.
Or if you, yeah.
Mhm. Okay, so now do we have time for questions, Selena? Or...
Yeah, I think we do have some time for questions, but I'm coming back on some of the questions you asked, Dagmar, because
Okay.
I'm curious about your advice for the students and the new grads as well. I mean, you have the most experience on the panel, right? You practiced for nearly 40 years. And so what would you say to the students and then to the new grads?
I would say exactly what Michael and Monica and Nicole said, to take as many CE courses and maybe do take what I did. I took an internship at SickKids right after I graduated. And that's how I got to love the RAP program, the Remote Area Sioux Lookout program, because they sent us to Sioux Lookout to the reserves for a month. We were going from one to another. So, you really develop different techniques and knowledge and broaden your spectrum as to what you would like to pursue. So I agree with that. I really would advise that the students, and yeah, learn as much as you can from the instructors. We're there for you. So pick our brain. Yes.
That's great. Also, Dagmar, just for you as well, again, because it's been 40 years, so the experience is immense, right? Like what have you seen change in the practice and in the profession from graduation to when you retired just a few years ago? You must, in 4 decades, see things shift quite a lot, even just being a woman in the practice and in the profession. Like, can you speak on some of that?
So when I graduated, I believe there were only 18 women out of 120. So the percentage of female dentists that graduated was so minuscule compared to right now. So times have changed, and women became more knowledgeable and better in the field. And as far as dentistry per se, when I graduated, it was more one dentist practice. Now it's becoming a little more corporate and multi-dentist practices. So I see changes that way.
Mm-hmm. What do you guys actually think? So I have 2 follow-up questions now. I'm jumping in.
Okay.
So with respect to the women in dentistry, so that's interesting, 18 out of a class of 120. And now at U of T, we have more women in the program than we have men. So in fact, we had to flip-flop the locker rooms to allow the women sort of the larger change space.
Mm-hmm.
So, what do you attribute that to? I mean, certainly women are not smarter today than they used to be. I can only assume context and mores of what is expected of women play into this. But do you guys have any sort of commentary on that? Accessibility, has that changed? Like, what do you think?
I'm a little biased because I'm in an office of all women.
Wow.
We are a 12
Cool.
office with 8 women dentists.
Amazing.
That's amazing.
And some of the men are a little shy when they come in. They're like, do any guys work here? But I don't know, and not to generalize, I think the fact that we are being more represented, a lot of our patients say that, did I drop you?
Nope, you're good. Oh,
I don't know, how do I say this without being politically incorrect, but they said it feels more caring, more nurturing. They feel more comfortable. Even some of the men say it. They're like, I feel like I'm being taken care of by my sisters. So I don't know. That's just personal perspective and the feedback that we get from our parents. And a lot of the kids love it too. So I don't know, maybe they're onto something. I think you're outnumbered, Mike.
That's all right. That's
Well,
all right.
even this panel, it's obvious. 1 out of 3.
I've got, I
Or
have,
4.
right, I have 5 other doctors that work with me. They're all female. I'm cool with
Oh
that.
my
The rest of my
goodness.
staff is female.
Oh,
I
yeah.
have 4 daughters at home. I'm surrounded by females. I'm all for it.
Wow.
Wow, 4.
That's
I'm
amazing.
all for it.
You're all-
Mike, why did you end up going into pedo? I'm curious because you've gone into grad studies. Like, how did that? I know Mike Siegel affected you deeply, but other reasons what took you down that path?
I kind of did not like anything else about dentistry.
But you like kids, is that what you mean?
Yeah. I got really nauseous when I looked at the microscope in first year histology, and then I realized that I cannot be an endodontist because you got to look at microscopes and it throw up on the patient. I did not, and so it's just a list of things that I just didn't understand about the other specialties. Like I do not know what a surveyor is, and I still don't know how to use a surveyor. I don't know if they still use surveyors. What other specialty? Oral surgery I was thinking about, but I could not bear the thought of standing up for 8 hours in surgery because I'm like, what would happen if I needed to pee? Would I pee myself?
Wear a diaper?
I would accept wearing a diaper in my 70s and 80s, but I'm like, I'm in my like 40s now. I'm like, I don't want to wear a diaper.
You're raising all kinds of questions in my mind now, but you know what? Playing to your strengths, right? I mean, I think many of us, when we look at careers, you gravitate to the things that you are naturally good at and the things that you typically enjoy. But it's nice. Yeah, it's just interesting.
Oh yeah, no, my first year anatomy demonstrator had told me, Michael, my kindergarten grandson is more mature than you are. So I was like, yep, it's pretty awesome. So then
But that is why you relate so well to your patients. I'm
Yes.
sure you're
That's
right,
right.
Yes.
And
I think like a 4-year-old.
You think
There you go.
I
Yeah.
mean, where that seems to be potentially for one person a hindrance, it's actually a talent of yours, right? It's a gift.
Oh yeah, no, if I worked in general dentistry, the adults would look at me and say, no, not this guy. Right? But as a pediatric dentist, they will tolerate it because the kids have a good time, right? They appreciate it and they're really excited and they're happy and that's fine. The parents are like whatever makes the kids
Yeah, it
happy.
makes them feel comfortable.
Yeah.
comfortable, relaxed. Yeah.
So wonderful.
That's
Well,
amazing.
we did have some fantastic questions sent in. And so, Dagmar, I think, can you see these or do you want me to pose them to the group or
Why don't you post them to the group?
Okay, sure. So here's a question. Where do you see the profession in 15 or 20 years from now? How do you think things will be the difference? How do you think things will be different or the same? And I open it to anybody. I'm going to call on Monica actually, because she's behind her veil here. And I know Monica always has brilliant things to say. Monica, do you want to speculate?
So how I think it's going to change over the next, it was 15 years.
Yeah, 15 or 20 years. Like,
Yes, I think to be honest, and whether we like it or not, I think that dentistry in Canada is going to become more corporate. That is just the trend that's happening. I personally don't really agree with this because I think that the standard when you start to move to more of a corporate model, but that aside, I think that's what we're going to see. And we're going to have to kind of navigate those waters.
Yeah. Does anybody else have comments on that? Agree? I would imagine too, we would be seeing things differently. Like I know that there used to be enclosed operatories was the thing, then it was the spa open clinic sort of concept. And now of course things are going to close down again. What do you think? We're going to see multiple pandemics. We're going to stay in this space. Do you think it's going to change regulations beyond where we are today? Like, do you guys have commentary about not the business of dentistry, but maybe the practice of it, seeing that?
Well, yeah, we were just talking about that today. Like, I don't know, I probably have permanent dents in my face from the N95 mask. And we just said, is this going to be the norm? Is this going to be what everyone expects now? I mean, the gown, the face shield, the mask. Is this what we're going to be in all the time? And is this going to continue? So that was one thing that we were talking about today. I don't know what you guys, but
I personally think that what we have set now will be the new standard. You know, I was told that back in the early 80s, gloves were optional.
yeah,
And now, gosh, if you look inside someone's mouth without a glove, that's like a professional misconduct, right? And so, you know, I think patients will now and frankly, as dentists, don't you feel a lot more cleaner? Because you look at your face shield, you're like, oh man, look at all that stuff that was on the shield. Like, that's not going, you know, on my neck, on my chest, or on my forehead, right?
One of the things that when I first came to, and I think it might have been Howie Tannenbaum who said this, was I heard the words crevicular fluid and it made my skin crawl. I just thought, I have never heard of this before. The fact that that comes flying out of somebody's mouth and would land on your face, right? Like, it is really interesting that it takes something like a pandemic and a very concerning virus to gown you guys up. Like, it's really, I mean, I know that things are in the way and it's expensive and there's all kinds of sustainability issues around these things, but I would think, I agree with you guys that it probably, as someone who sits in the patient chair, that I would anticipate seeing my dentist next week and 10 years from now exactly as they are today, even if the virus goes away. I tend to agree with you. Hopefully they can figure out a way to make it more environmentally sustainable, though.
No, Mother Nature is just crying right now with all the waste, right? Like, I was talking about it with someone today, and in the past 20 years, we have dealt with SARS, right, in Toronto, back in 2002, 2003, and then there was a localized outbreak of MERS, right, the Middle Eastern one, and now we have COVID. So in a span of 20 years, we've had 3 kind of outbreaks. No, it's like, we will get through COVID, but it's going to be the next one that's going to come down the pipe that, you know, the reason for all this PPE and, you know, 4 walls and a door and all this other jazz. So
yeah. Thanks. Thank you for commenting on that. So another great question is, how do you feel about the idea of Dentacare or dental care being part of OHIP? You guys got sort of vibes on that? I'm going to call on Monica again because she's hiding. Oh, Monica, are you there? All right, we'll come back to Monica. So anybody else?
I will jump in, but I am kind of probably going off the reservation. As a pediatric dentist, I will see children with bombs all over the place, like 12, 16 teeth with just large carious lesions, right? When I drop a treatment plan of, you know, $4,000 to $5,000 or even $6,000, and I look at the parent and I say, this is what the suggested pediatric dental fee guide is, right? For a family that's, you know, making ends meet or struggling with COVID, it kind of frankly sucks, right? You know, because maybe they don't have one child, maybe they got 3 kids or 4 kids like I do, right? And you're like, man, I got to drop $6,000 on my kid. So thankfully in Ontario, they have the Healthy Smiles Ontario program, right? And I will oftentimes utilize that. Yes, you know, I take a financial hit for it, but I do it because your kid has cavities, right? Like, I'm not in it for the money. I'm here to just fix the teeth. Right. And I find that that's oftentimes a barrier or a barrier to access to care. Right. Because then the parents are going to push off treatment, or parents have told me, you know, can we just only do like 2 or 3 or 4 of the teeth and I'll come back next year to do the other. And I'm like, man, your child's going to go to sleep. Let's just do it all. And I'll just, you know, I'll sign you up for the program. We'll eat the costs. We'll work out something, and they're appreciative of it. So I'm all for it, but I may be a minority for it. So that, like I said, I'm going off the reservation. Sorry.
I think that they have to do more in the schools or more for prevention. Like, you see them after the fact, like we see them after the fact. And why not have some type of program in place in the schools where they talk about these things? They send stuff home to parents. Like, why isn't it a part of their curriculum or something that the parents can get more information on before it gets to that point? Like, there are public health resources that can go that way, because by the time you see them, it's too late usually, right?
Mhm.
So
Yep.
Or even for new parents in general, I feel like a lot of people have no idea, like, what am I supposed to do? Am I supposed to clean my kids' teeth? But then you can end up with, someone who's not yet and need to do extractions, pulp and crowns, you know what I mean? So even at that level, I feel like maybe we need to do more.
yeah,
There's no good instruction book on how to raise a kid.
Yeah.
wish they had one, but yeah.
Yeah, I mean, this is the thing. I mean, you don't go to school to learn how to raise a child, and I can imagine when you take kids in, and even myself, I have 2 sons, and as much as I know, my sister's a dental assistant, so she was on me right from the get-go, with the little finger with the nubs to rub their gums and their teeth, like right from babyhood. We've still ended up with cavities because kids will eat a sour key that grandpa gave them, and you don't get in there with the floss, right? You do the best you can, and then all of a sudden a cavity comes in through the side. At the same time, I'm privileged that I can pay for dental care. So, this perspective of universal care and sort of combining it with OHIP so that children and families have access regardless. It's an interesting discussion, right? Versus fee for service.
Mhm.
And you know what, Mike, I'm happy to hear what you had said, because there's always that tension of, are you a business owner? Or are you a healthcare practitioner? And you're both, right? You have to have a viable, sustainable practice because you employ people, you want to stay in business. But where's that line? Oh my gosh, that's my favorite thing. That was the best. The cat bomb.
Brilliant.
But trying to make all of those things come together for families and patients, it's huge. It's a big thing. So anyway, well, thank you both, or thank you all for commenting on that. And here's a lovely question, which I think is a good one. Tell us, I just clicked on something else. What do you wish someone had told you about practicing dentistry when you first graduated? This falls into an advice category, but did you guys find yourself in a position where you're like, gee whiz, I wish I had known this?
It's not always 9 to 5.
Yeah.
It is if you're a pediatric dentist.
Yeah. Yeah, I remember my demos were saying it's a great profession. It's 9 to 5, Monday to Thursday, golf on Fridays. And you're like, oh, all right. And then you get into private practice, at least in the GTA. I mean, I can't speak for everywhere. And it's evenings and weekends. When you start out, you're probably going to have to, keep not shaking your head, Mike. But
I'll write you that recommendation letter. I'll write you that letter.
Hopefully my boss isn't watching. No, but if you're in the GTA, you do have to put your work in. You might have to do some evenings and weekends. And then if you get seniority, at least in this case, you can kind of cut that back, but you expect to work a little bit harder than you thought initially.
Thanks, Nicole. Dagmar, what about you? Like, do you remember things from back in the day when you graduated? If you were like, gee, I wish I had known this, or somebody had told me this about dentistry before I took this path?
I think the same, the hours and the amount of time you have to put in when you start out.
Mhm.
You have to put in the hours, the time, and then it will pay off. But the start is the most difficult. So you have to be prepared for that. Yeah.
Mhm. Mhm.
I would, I would say that as a practice owner, learning the business side of dentistry. There are business courses that are taught at the university, but they're not the same as, making HR decisions, kind of ordering of supplies and just the day-to-day running of the office. Like, yes, you know, U of T will teach you, you know, how to cut an MODO or how to do a, you know, a crown or do an extraction or root canal, but it's like, okay, you got to hire someone. Who do you hire? Right? Like, what type of contracts do you need? You know, yeah, all that other stuff. And you know, I think if I had, and like we talked about inquiring about our clinical demonstrators, about the clinical aspect of dentistry, I'd also encourage the students or the new grads to ask, you know, the clinical instructors and or, you know, the principals, what's the business side of dentistry, right? Like, because that also plays a role in how successful or how successful you will be or how you feel in terms of your worth, right? Because you're
I imagine too, it helps your stress, right? I mean, when you know what to do, we all feel more competent when we feel prepared in any situation. So yeah, makes sense. Monica, I'm feeling so bad for Monica and her internet, and I want.
Sorry.
Oh, we can hear you.
You can hear me now?
We can
Yeah,
hear
we
you.
can hear you.
Yeah. Have you got any thoughts on this?
I have to agree with Nicole and Dag about the hours and the amount of work and probably the physicality of the job. Now, after been working for 5 years, I don't think I would ever work more than 4 days a week. That's a personal decision. Just, I think physically, I don't think my body can handle it. And I think burnout is a real thing that maybe people don't initially think of. They might be pushing themselves like right to the brim, but you really you have to take care of yourself, because at the end of the day, if something happens to you, if you can't work, you're not your profession, your career is done, right? So,
but when you say your body can't take it, what does that mean? Is it a position thing, you guys?
It's a position thing. It's, you know, depending on what kind of practice you're at, like you're always on your feet. Like as a general dentist, you're constantly running, you're doing recalls, you're doing all these things. I mean, you're physically tired at the end of the day, especially if you're doing long hours. I know some of my classmates do very long hours. I used to do longer hours. I've shortened my hours, and also with a kid and with a family, that's really changed things. So you just need to, I guess, just keep your wellness in mind. You know what I mean? I want to be successful and everyone wants to do well, but sometimes it's good to just take a step back and just to be mindful of that. I'd say that's maybe what I wasn't made aware of at the beginning.
Yes. If you don't mind, I'm going to add to that. When I first started, I associated with another pediatric dentist, and he told me that your career dentistry should be a marathon and not a sprint.
Yes.
Right? With the idea that, you know, you want to, you know, work for, you know, 40, 50 years and not have that burnout, right? So pace yourself. You're not going to be, you know, you're not going to, you know, kill it right away. Don't worry about it. Just pace yourself. Right. And
absolutely.
yeah, I'm 15 years out, and, you know, I feel great. Like I have a good variety in terms of, you know, private practice, teaching, hospital, you know, and I don't do evenings and weekends for it. You know, pediatric dentistry, way to go. And so, yeah, no, it's that variety. And so, you know, I see myself working, you know, they say, oh, what's your retirement plan? I'm like, my retirement plan is death. You know, I'm going to work till I die. Right. So I'll be working on a 3-year-old or 4-year-old, and that's it.
Michael, don't say that.
Hopefully in another 40 years. Hopefully in another 40 years.
Another 40.
Yeah.
Yeah.
No,
Yeah.
it's true. Mhm.
That's funny. That's funny. Any other comments on this from Nicole or Dagmar?
So
Don't feel you have to answer. I want to open the floor.
Yeah, just kind of touch on that too, is that when you get out of school, and I guess everyone's at different stages in your life, you're like, whoa, I finally get to pay off my debt. And, you know, any practice, be like, oh, you want to work a 12-hour day? Sure, here you go, you know. So it's easy to take on way too much at the beginning, and you're just so excited to get started and, you know, pay off the debt. And then like you said, you'll find yourself starting to burn out, and it's so much harder to pull back once you've already made those commitments, because, you know, they've hired assistants, they've hired all these people who are depending on you to make their hours and their paycheck. So always, I would say, start off again slower and then slowly work up to where you're comfortable, and don't bite off more than you can chew when you start off.
Yeah. I think that's great advice. We're kind of close to time, but I have a questions around IDAPs, and I'm not sure how well positioned you guys might be to sort of answer this, but the question is if you had any advice in particular for IDAP students and IDAP grads. Anything that you would suggest differently than you would to any other student or grad?
How are they in a different situation? I mean, other than having more experience, which might be great. I mean, do they find that they're at a disadvantage, at an advantage? Like, what's their concern?
There's no context around it, but I wanted to pop it out. Just any tips for IDAPs graduating out of the program. But I think you guys have done a nice job of sort of across the board, it would apply regardless. And in fact, I have a lovely question actually for you, Dagmar, from Lynn Tompkins, which is,
oh no.
can you tell us about treating the same patient in Sioux Lookout for 30 years after going there as an
Oh yes, oh my goodness. So I forgot I shared that story with her. When I was at Sick Kids doing my internship, I went to Sioux Lookout to this community called Webekwe. And after 30 years, I go to the same community, and I'm looking at this patient who was now 45 or whatever, and I look in her chart and I'm like, oh my God, that's my signature. So I took a picture of my signature in 1981 or 82. Yeah. It was amazing. It was amazing experience. And she was laughing too. She was very comfortable. She said, yes, everyth's good. Yeah.
Your dental work from the 80s held up.
It held up. It held up. I was so proud. Yeah.
Good.
Yes.
Good for you.
That's amazing. Thank you, Lynn, for that question.
She also wanted to see your Dentantics photos of you dancing back in the day, but you know, people can pull
maybe next time. No,
books.
she actually has some photos. She has some photos she forwarded. So if anything, she can forward them to you.
And I can put them out.
You can put them out.
Do any of you have sort of any final comments or any other pearls of wisdom or stories that you want to share before we just sign off for the night? No, we're good.
Oh, good luck on your boards. You'll get through it.
Yeah.
So,
good luck on your boards.
Enjoy the last few weeks or months before you get out into private practice, because like I said before, I stuck with
real life stuff.
Yeah,
real life will start.
You're no longer a student anymore, and
exactly
the buck stops with you. You will be licensed if you practice in Ontario, and you will be held to the same standard as all the other dentists that have been practicing for a number of years. So you know, not to say that you want to slack off now, but you want to just enjoy your time before you work, because once you work, man, it's a grind. Oh, when you practice, try to set your vacation schedule in advance. Now, you can't do it right now because of COVID, but lay out the year of, like, let's say 2022, and say, you know what, I want to take this week off. And that way, when, you know, that time rolls around, your office won't book you recall patients, and you're like, oh man, I've got 3 columns, I can't go. Dang it. So book that time off before.
And
that's actually good advice.
Take some time off between dental school and starting to practice.
Yeah.
Like, don't jump into it right away. You're not going to get that time again just to relax and just to say, I just finished, I don't know, 7+ years of school.
Yeah.
Like, just take some time, take a month, I know it's COVID, been doing pretty much nothing for a while, but just use that time just to take time off before you jump into practice, and then it's go, go, go. So
exactly. It's so true, because someone told me the same thing when I was in dental school. They said, enjoy this time. This is the last time you'll be sort of free. You very soon you'll become an adult, so to speak. You'll have to, the bills will come in. And I didn't know what they were talking about. I said, what do you mean? I'm so stressed out. I have exams and this and that. But they were so right. Those times were good times, carefree, and you won't get those times back, basically. It won't be the same. Yeah.
Thank you. Thank you all so much. I think, you know, hearing about the importance of self-care for sustainability, I think for anybody to continue in any job as any human being, right? You're not machines, you're human beings, and to be kind to yourselves, to reach out to others for advice and support in school, out of school, with your colleagues, you know, working through all of the challenges that you have in dental school, but also then CDE for other opportunities or adding a year. I think sort of the context and the information that, you know, Michael, Monica, Nicole, and Dagmar, all of you gave, and also just sort of your fun way of sharing stories and your experiences, I think has been appreciated by everyone. And I want to thank you so much for being part of our Young Alumni panel. Just being here and providing us with the context. It's been lovely to have you. And I know our audience has appreciated it as well. And I've appreciated as well the questions coming in from the audience to our panel. So with that, I think we'll sign off, and I wish you all a wonderful U of T alumni weekend. Tomorrow morning, there is the Kids Passport opportunity. So people with kids, if you want to do the U of T Kids Passport, Dentistry is participating along with a variety of other faculties. So they're just sort of fun, short kids activities that you can do online. And as well, we are offering a free CDE Core 1 course tomorrow as well in forensics dentistry. So that's been part of our U of T kind of Dentistry Great Alumni Home Edition offerings this year. So with that, we'll say good night, and thank you again all so very much for being with us. I look forward to seeing you in person, maybe at the Great Alumni 2022 if you can be in Toronto, and we'll chat with you all soon. Thanks.
Thanks.
Thank you so much.
Bye.
Good night.
Good night. Good night.